Dawn, I'm recording this for you. I'm gonna share my screen so you'll see what I'm seeing. What you said was that the patient's range was 3.98 bioelectrical. I want to make sure the audio is recording. Okay, so your bioelectrical is 3.98, and you were right. There were 45 markers out of range. Of that, 34 was food related and 6 was stress related. And at a glance, you could see parathyroid was the main issue when you looked at the stress markers. And the other thing I quickly go over, whenever there is a parathyroid, it means the patient is extremely acidic. Whenever patient's acidic, parathyroid gets involved because to compensate, it tries to pull calcium off the bones and it makes them osteoporotic. So that is one thing quickly to understand. And also, I think I briefly saw the C3, which is kidney bladder meridian, which was affected. And usually when there is kidney affected, it means there is some sort of an interference field and it's coming from tooth. So you need to ask them whether they have fillings or something in their teeth. And then here, when you look at the EAV point, right, the heart, but if you look at the score, when I went and looked at the Zyto report, it was 12.20, right? And it's minus. When it is minus 12.20, what it means is they've gone beyond inflammation to degeneration phase. So that means for them, typically, it would work well if you build them up first before doing detox. I hope that makes sense to you. So it's a heart meridian. So you want to do, yeah, 1 minute, 1 minute. Okay. Yeah.
All right, 1 minute. He's here.
Yes. I'll come and call you. So you would do rebuilding them. So doing nutrition first and then detox. Okay, that is one thing. And then you were right, like you kind of pull. So you could even see toxins, BP asthma, toxins, and if you see pH acidity, you could again and again see that it's toxin. But because he is gone beyond inflammation to degeneration phase, you would even consider doing vitamin C, bring it up, and I think build him up, doing IV nutrition first, and then starting the detox would work well. This is some of my suggestion, and I hope that made sense to you. And I'm going to share this with you, okay? So I think methylation and other stuff will do too. So try to see whether you can start with IV nutrition, putting him through nutrition protocol with a vitamin B, vitamin C, vitamin D protocol, and then coming back to your other protocol. And this helps. I hope this helps. Okay.